Half a day and good morning, everyone. Thank you so much for joining us today on this TakeCare Check presentation. We have this partnership with University of Guam for many, many years. And, I myself serve as an advisory council of our College of Nursing. I couldn't be proud to have this continued partnership with, the place that I work and also the place where I, partly teach and mentor students. With this pandemic and this unprecedented time, it really put a spotlight on the need of the nurses. And UG have stepped up into that response, not only on working together with the stakeholders and graduating the class of 2020 early. And just to want to remind everybody, those 26 students are out there in the hospital in different healthcare settings, being a frontliner during this pandemic. And I couldn't be proud to be working with those amazing team of students. And also with this faculty, I know they work so hard, and UOG is in also working and putting together our CNA program, all these other supports that we work closely collaborating with the stakeholders like us, TakeCare and FHP, and also the rest of the community. So with that, I just want to show the team, both of us, this continued working relationship in this partnership and in the amazing team things that we can do together. And I really want, before I introduce my colleagues here at TakeCare and FHP, I really wanted the great example of our partnership, and I'm so proud to really introduce her. Dr. Margaret, let me introduce her. So she is a recipient scholar of TakeCare, and she is just newly a doctor, a DNP, got her DNP, Dr. Rosie Baubata, which is there. And it's truly a testament of how our partnership and working together, and now she's going to be there working and mentoring and producing more students along with Dr. Margaret Hattori-Uchima, and of course with the the guidance and the leadership of Dr. Thomas Krise of the University of Guam. So with that, let me introduce our team here at the TakeCare. So you see in the camera our health plan administrator, Arvin Lojo. And I think I see our corporate administrator, Almira. And we do have our team on the mid-management and the plan side that you've seen earlier. Also on the clinic side, I'm proud to say that, these are the managers here in the clinic. The 3 nursing leaders here in the clinic are a proud alumni of University of Guam. This is your product. So you have, Jennifer Artero, which is also helping us with educating students. And you have Carmencita or Menchu, known as Talig, is present with us over here, which is a UOG grad. And also Annalyn Gagarin is also on this call. And there's also University of Guam. And we continue. You have not only them, but I have many more of these employees and nursing team we have that really a proud product of University of Guam. And this time, I would like to ask our partner, our University of Guam, to say a few words or say something during this time.
Thank you so much.
I'll let the president go first.
I thought so.
Let's say something briefly and then let Margaret say, but thank you very much. This is really a terrific demonstration of partnership across Guam and really serving the whole region. And now this pandemic is just highlights how important this is, how the cooperation of many years, the relationships, the alumni, everything has really been highlighted. And so the importance of our healthcare system has never been more obvious to everybody. Everyone on this call has known that that healthcare really is important and is critical to every other thing that we care about, including and being able to see friends and family and traveling and everything. So, but this has really called attention to this. So this partnership, I think, will help us continue to make that case to all of our neighbors and friends in the community to continue to build the strength of our healthcare system in Guam and for all of Micronesia. So I really appreciate this help, this partnership. Resources are always tight, as we all know, and so we really appreciate, much more so than any other place I've ever been, we always appreciate the kind of support that we can get on any level. And of course, our School of Health and our nursing program and Dean Margaret and her faculty and staff have done a terrific job. I mean, it's been really humbling to the rest of the university to really almost every day, certainly twice a week, we're getting updates on what they're doing, how hard they're working. Some of the challenges that they've had to overcome have been really amazing. We're very proud of our students, especially the accelerated years graduated and the others who are busy working in their rotations and serving on the front line of this pandemic. And so just, it's a real occasion for pride, certainly for me and for the whole Triton community. So so thank you very much. And I'll let Margaret say, but I'll say Biba, take care, and Biba UOG.
Biba.
Thanks, President Krise. He's been so supportive of all of us. And I really want to thank we have our staff, Jonathan, and I don't know if Lynn is on, but John and Lynn are the ones that have been instrumental in managing our TakeCare funds. And of course, you know, without having the staff to help us draw down those funds and allocate them appropriately, you know, we wouldn't get anywhere. But I have to tell you, and our faculty are here. I know Dr. Rosie Baubata, Dr. Anna Varghese, who also was supported by TakeCare. Natalie Capacci is on, and Vicky Alave, and I know we have some students. And so I hope I didn't miss any faculty. I think I got everyone. So we really appreciate it. But what I wanted to highlight briefly was that when the pandemic hit in March, we knew that resources could be an issue. And early on, when we started, we had to stop clinical, but when we decided to resume, GRMC graciously allowed us to continue our fundamentals of nursing clinical. But immediately we knew we couldn't have as many students in a practicum for safety reasons. And right away we just said, okay, what's a safe number? You know, let's get the faculty out there. We're not going to worry about having to pay the faculty. We'll pay the faculty, but the one thing I have to say is it's such a burden off of me to know that I can use the TakeCare resources to pay for the faculty so that we can get our clinicals done. And early on, when we decided to graduate the seniors early, the staff, Jonathan, really helped find we decided, okay, let's buy them the Kaplan Online Review, which is really a Cadillac product. And we've never spent our TakeCare money on that before because we always spent our money on other things like mentorship, but we couldn't do mentorship because of the pandemic. And just having that TakeCare funding, you know, Rose, it was such a relief because we could say, yes, we need these students to graduate early, but if they can't pass NCLEX, graduating early is meaningless. And so far, our pass rate is still very high. They haven't all taken. You know, right before the pandemic in January, our last student from last year took, and so we're 4 years in a row of NCLEX, 100% NCLEX pass rate. And that is, you know, in large part thanks to TakeCare. And so just the comfort of having your funding, that I know I would not be able to have that funding from the local sources, right? It was able to give us some comfort in being able to provide the students with the Kaplan. We couldn't do face-to-face NCLEX review, but we were able to buy each one of them the Kaplan product. And it also provided the students the comfort in knowing that, hey, you know, we've got a revenue source to provide those resources in such a desperate situation. And I know our colleagues, you know, in other nursing schools in the nation are suffering. You know, most of the universities are having budget cutbacks, and they are suffering as well. And so, you know, I always thank TakeCare, but I don't know if you know just how much that really means to us, especially during a pandemic. Guarantee you, if we didn't have that funding, I don't know if we could have been this successful with our graduates. And Dr. Rosie's a great example. You know, she works at GMH at the Med-Surg unit. So during the pandemic, she's been working, you know, tirelessly there, as well as teaching our students. And so we're just very proud that TakeCare was able to support a portion of her DNP, Doctor of Nursing Practice, and she's full-time faculty with us. And we know she's gonna be one that we keep forever, right? Just like Dr. Anna and Miss Vicky, right? We're here for the long run. And we're here for our community. So really, thank you so much. And don't forget, lastly, that, you know, TakeCare, I was one of the first faculty that TakeCare supported. Yes. And without TakeCare's funding, I know I wouldn't have gotten my PhD. And so I owe so much to TakeCare. And I believe the university definitely was wise in using that money for capacity building, as well as for strengthening our daily operations. So thank you so much. I really appreciate it.
Thank you, Dr. Margaret. But I just want to also, Dr. Margaret is a pride of Guam and to the nursing community. She just got inducted to a prestigious group of being a fellow of American Nurses of Academy of Nursing. So yeah, you bring pride to Guam, and we truly, you know, proud of having this partnership and working with you, and also a recipient of a TakeCare funds.
Rose, can we see if Rosie wants to say a few words?
Of course, absolutely.
Yes, hi, good morning, everyone. I'm at GRMC doing our CNA clinical. So I'm very, very grateful and very blessed that TakeCare was able to help me with my doctorate in nursing practice. They helped me with the scholarship. So I'm very, very grateful and very thankful, and us to give back into the community. I will do my very best to help the island and to help the student with the University of Guam. Thank you so much. Very appreciated. Thank you.
Thank you, and stay safe, Dr. Rosie Baubata. I know we have Dr. Ana Vargas. Is also, I know she worked closely with our FHP and the TakeCare.
Yeah, thank you so much, FHP. So we, again, I'm also a recipient of the scholarship, and that's how I got my doctorate in nursing practice as well. I don't know if you can hear me well. The reception, the network is very weak here, but once again, thank you for your support.
Thank you, Dr. Ana Vargas. Let me ask our corporate administrator, Almira, to also say a few words of greetings.
I just want to say congratulations to UOG for consistently delivering good results for nursing NCLEX. And, you know, my wife is a graduate of UOG also, and I appreciate the quality that you deliver, and it shows in the community that your graduate really helped the community. Thank you again, and Merry Christmas and a prosperous New Year to all.
Let me now introduce Mr. Arvin Lojo, the Health Plan Administrator for TakeCare.
Half a day and good morning, everybody. Thank you for joining us today. Again, this partnership with the University of Guam, particularly with the School of Nursing and Health Services, has been going on for more than 11 years. TakeCare is very proud to be part of this partnership, particularly because the programs at UOG raises the standard of nursing on Guam and also enhances the level of healthcare for all the residents of Guam and also the Marianas. Again, we thank you for all you do for the community. We support your efforts, and we look forward to your future accomplishments and more things to come. The real check is ready, but for the purpose of the presentation, I'll hold up this check for everybody to see. So Dr. Margaret already got it. So, but this is the big check for everybody to see. But the real check already, Dr. Margaret has it.
I wonder why she has that big smile, because she has the real check.
Thank you. You made my year.
Yeah. And that concludes our Zoom presentation today. And of course, I really wish you guys a blessed Christmas. Enjoy this holiday season with the family, and hopefully in our next presentation or when we see each other is no more virtual, and hoping that the 2021 is coming us in a better better year. And with that being said, this concludes our presentation. Thank you, everyone.